One most common question which is asked regarding the Mendelian inheritance is a given disease, whether it's autosomal dominant, recessive, X-linked dominant, or X-linked recessive. They're very useful mnemonics. Remember that for autosomal dominant, one fat hen dominates in main picture as a mnemonic and other diseases which I have already given to you. But what you need to emphasize on is there is variable expressivity and penetrance. The disease manifests in the heterozygous state, usually in adulthood. Moving on to autosomal recessive disease, remember the enzyme deficiency diseases are usually autosomal recessive with 100% penetrance, 100% expressivity, manifest in childhood, usually in homozygous state. All good CS engineers will face money turbulence in heavy recession at present is the useful mnemonic. For X-linked recessive, which is expressed in men but females are usually carriers, the most useful mnemonic here is why Lesnihan called granulomatous disease as Fragile X. Remember this useful mnemonic. For X-linked dominant, we have limited diseases like vitamin D resistant rickets, Rett syndrome, and Alport syndrome. Thank you for your attention.